first I would like to ask you permission to use this video for educational purpose and on internet.
Yes, that's fine.
Tell me first about your finding, your symptoms, your pain before the surgery.
My pain was that I had was always high. 8,
Tell
9.
me about it. How high?
8, 9, all the time.
Okay, how long did you have that pain?
How long?
Yeah.
I fought it for probably a year and a half.
Okay. Now, the pain you had in for a year and a half, 1 to 10, how bad would you say it was?
How much was that?
1 to 10, how bad was that pain?
It was high. It was said 10 all the time.
10 all the time, both in the back and the leg?
Yeah.
And I'm going to turn around. You weren't faking that pain. Here it is. This was your back before the surgery.
Yeah.
And you had quite significant what we call scoliosis. And that scoliosis was almost 26 degree when you are laying down. When you are standing up, that was even over 35 degree. So how long were you living with that pain that was so bad and you could barely walk?
I was eating Tylenol consistently. I mean, the pain was every 2 hours, every 3 hours I had to. So, I mean, I don't know what my liver looks like.
Yeah, I know. Now, the surgery was about a month ago.
Yeah.
And in that surgery, first I'm going to turn around and show what we did. We corrected your scoliosis that used to be about 35 when you're standing up. It is now, I'm going to just measure it here. About less than 10 degree, 9 degree actually. So most of the scoliosis is gone, but that scoliosis when you were standing up was getting worse. Now it is actually not going to get worse because we put these metals inside of you. And these are the screws in your back. Look at that. In some of the area, those screws are barely any, the bone the screw is going through is barely any bigger than the screw. So we put really big screws in, so we fill the space so you can have a good connection there. And look at that. These screws are all perfectly located.
Yeah.
And here we are. Some of the other screws, they're perfect. You see how detailed these pictures are? Even you see the hole inside of the screw.
Yeah.
And then you see they are connected. And if you look carefully, you see that we put those spacers in a place to correct that scoliosis. So we put it more to the left side because we wanted to lift up the left side. Again, if you remember, you were bending a lot to the left.
Yeah.
Now, the surgery was just about a month ago. How long did you stay in the hospital?
I was what?
How many nights did you stay in the hospital? Do you remember that?
No.
No?
I think you were overnight.
Yeah.
I think you were overnight in the hospital.
Yeah. I remember I sent you home next day after the surgery.
Yes.
Now, how bad is your pain now?
It's tolerable.
Yeah. What number would you give your pain now?
A 5 maybe.
A 5 maybe. Yeah. Now, that pain was 10, is now 1 month later 5. I remember you had pain right here.
Yes.
How is that pain?
It's still there.
1 to 10. It was. How bad was it before the surgery? How bad is it now?
It was always a 7 or 8.
9. How about 7, 8, 9? Yeah. How bad is it now?
It's 4. 5.
4. So better. So pain is much better.
Yeah.
And that is a very good sign. But now we have a very special kind of, I would say, complication with you. And that complication is that you are weak in some of the muscle. Can you tell me where you are weak?
I'm weak in my legs. I can't lift them up.
Yes, so yes.
I gotta have it lifted with my hand.
Yeah. Now, I checked all your muscle. All the muscle are full strength except the muscle that bring the knee up. We call that iliopsoas muscle. Okay. And I'm going to show it to you. That is this muscle right here and right here. They go from your spine. They attach to your bone here. in the thigh to bring the leg up on both sides. Here.
Yeah.
Now, in bigger surgeries, sometimes what we have is that literally when we poke sometimes through the muscle to get to the disc, the muscle doesn't like it. We call that iliopsoas compartment syndrome.
Okay.
And that can sometimes make people weak. But that is on the side that we go with the cages in, with the spacers in. That's on the left side.
Okay.
But that's not your problem. It's not in your case. You're not much weak on this side. You're mostly weak on the opposite side.
Yeah.
And that is actually very rare condition
Okay.
that when you have a lot of scoliosis, your spine is bending a lot. And then we bend the nerve and the muscle because we are bending the spine correct way. We bend as well the nerves and the vessels and the arteries and veins and so on. We stretch them sometimes.
Yeah.
In your case, we looked at all the hardware, they're perfect, and your symptoms are on the opposite iliopsoas muscle. So my best guess is that the stretching of the vessel and the nerve is what's making the other iliopsoas muscle weak. And that has a good prognosis, meaning that with proper exercise and so on, that nerve and the vessels, and they can actually grow. They are living things, they can grow. So meaning now that we have to concentrate now on getting the strength on that side back with physical therapy.
Okay.
There are a few things that I think is important. Your bone was on bone right here where we did the surgery. We lift them up. And I told you, and I think you told me you noticed that as well, that you are actually walking more straight and you're taller.
Yeah.
Did you notice that?
Yeah, I noticed I was.
Yeah.
I could feel taller.
Yeah. What did you notice about that? How did you notice that?
That he didn't slouch as much.
Yeah. So
Yes.
even with this weakness, he's walking better. The pain
Yeah.
is better, and that is something that is very rare. What you just described. About less than 3%, 5% of the people get iliopsoas compartment syndrome, which would be on the side we go in. But this, believe it or not, extremely rare. But sometimes it happens. Okay, but now, but the prognosis is overall very good.
Yeah. And
People
I think
get better,
he'll be
much
standing
better.
up straighter as time goes on.
Yeah.
Yeah.
You told me another thing that tells me that we are on the right path. You told me that you barely could move it on that side, but now in the last week or two, you can move it a little better.
Yeah.
Yeah,
I've
and
been
that is,
working.
yeah, it's going to take a few weeks and sometimes even a few months, but with proper exercises and so on, that has a good prognosis.
Right. You can't give up.
No, not at all. You have to work hard on it. Any question for me otherwise?
No, I'm fine.
Excellent.
2 questions.
Oh.
Yes, go ahead.
Yeah. Well, when you order post-op physical therapy,
Mhm.
will wherever he goes, will those people know what to work on?
Exactly.
Oh,
They
they
will know
will.
exactly working on the iliopsoas muscle and the proximal upper extremity and work with them, and as well on your gait. That is important to make sure you don't fall. You said
And the
second.
second question, he wasn't sure about the bone growth
Mhm.
thing.
Stimulator?
Yeah, and so the girl that was in
Yes.
here said he could talk to you about it.
Absolutely. First of all, you have that brace that keep your back safe, give you comfort. This is regular what we call LSO back brace. You keep it on for 4 weeks after the surgery when you walk, and up to 4 months, and in your case, maybe even a little longer when you're in a car or any vehicle that shakes you. The bone growth stimulation device, you put it about sometime between 2 and 4 hours a day on. Each device is a little different, but then with electromagnetic wave, it makes the bone grow faster and better and stronger. And you should have it on for the first 9 months after the surgery. And that is usually for a big surgery like that, is always something that we recommend to make the bone grow better and stronger.
It does.
Yes, it does work. It does work.
Okay.
Yeah.
You trust him.
Yeah. Any other question? It just make the bone grow better and stronger. Especially, I apologize telling you, you're not 20 anymore. You need all the help you can get.
Yeah.
Okay.
Yeah, 'cause
You smoke?
Yeah, I do. I'm down to a half a pack. I was.
Yeah.
I was over 2.
Because he was a truck driver for 40
Yeah.
years.
I know. I can tell everybody smoking is falling off the building in slow motion.
Oh,
Meaning that smoking will get you one way or another.
yeah.
You are going to do yourself a huge favor by quitting smoking. Many of my colleagues, they wouldn't even give you the option of the surgery as a smoker, but because we don't disturb any vessels in a regular surgery, we literally strip the muscle of the bone. We reduce the vascularization, blood perfusion to 25% of the original value. So open surgery wouldn't even work with the smokers, but our surgery, because we don't disturb the muscle, we don't disturb the tissue, is still a good option, but still your chances of healings are not the same as somebody who doesn't smoke. Smoker, diabetes, osteoporosis, these are things that even make it more necessary to put that bone stimulation device on, because that gives you additional boost for the bone growth. Anything else?
No.
Thank you.